In 2020, 4.77% of the new cases of cancers in the Philippines were identified to be head and neck cancers. This amounts to more than 7,000 Filipinos diagnosed with the condition, a number that raises questions and demand for available consultations and treatments. As we celebrate Head and Neck Cancer Awareness Month, we are here in the University of Santo Tomas Hospital to get professional insights on head and neck cancer and its existing facilities and services catered around the condition. My name is Chelsea Rushana, and this is another episode of Lifeline, the show where we improve our lives by feeding our minds. The UST Hospital houses various institutes and units, each focusing on their specific specialties. One of those is the Benavides Cancer Institute, a multidisciplinary approach team of medical staff that handles all cases relating to cancer. So, Dr. Mejia, what is the Benavides Cancer Institute po ba? And ano po ba yung mga activities or healthcare services na available po dito?
Hi, Chelsea. So the Benavides Cancer Institute, or the BCI, was founded in 2006. It is the first one-stop shop cancer center in the country. It aims to give multidisciplinary care to cancer patients, regardless of whether you are rich or you are poor, wherever you come from. The philosophy of the BCI is unique in the sense that it is also the first in the country to deliver what we call systems-based cancer care. So unlike a general cancer hospital or a general cancer center, which treats everything, we aim to subspecialize in the different cancer's tumor streams, like central nervous system, head and neck, thoracic, breast, gynecologic, urology, prostate, soft tissue sarcoma, pediatrics. And the past 20 years has shown that all of these systems are growing. And again, it is also the first in the country, and I think the furthest on in the country that is delivering multi-specialty care that is systems-based or tumor stream-based. So we have different activities, including patient care, conferences, research, educational activities, basically in 10 subspecialties. We talk about the CNS, meaning the brain and the spinal cord. We have the head and neck, which is in between the brain and the clavicular bones here. We have thoracic or lung cancer specialties. We have breast cancer specialties, gynecologic cancer, gastrointestinal cancer, urologic, meaning bladder and prostate cancers, sarcomas, meaning the soft tissues. We have a very strong pediatrics program, meaning children with cancer. And we also have strong support base from our palliative care and nutrition and nursing services. We also have what we call brachytherapy specialties in the Department of Radiation Oncology, which also caters to the different subspecialties like the CNS, the head and neck, the gynecology.
Among the many cases that the BCI handles is the ones of head and neck cancer patients, which are classified into different types depending on the specific affected area. Oh, I see. Ngayon naman po, mas mag-focus po tayo sa head and neck cancer. So, Dr. Mejia, ano po ba yung head and neck cancer? And meron pa po ba siyang iba't ibang types?
Yes. So, Chelsea, when we talk of head and neck cancer, we're talking basically that area in between the roof of the brain and the floor of the neck. So everything from around here. This includes different subtypes like the nose, the nasopharynx, the voice box, the swallowing mechanisms, the salivary glands, and the air cavities or the paranasal sinuses in the head. And each of these subsites are treated differently. Some need to get surgery first, some need to get radiation first. There are some that needs a combination of surgery and radiation, or surgery and radiation and chemo, or radiation and chemo. So it's a very interesting but very complex subsite of the body.
Oh, I see. And paano naman po ba nako-contract yung head and neck cancer?
For the most part, we can think of three ways how we get head and neck cancers. Of course, the most obvious one is lifestyle, smoking, drinking, no? So that makes us prone to develop cancers of the voice box, cancers of the upper aerodigestive tract. But there are also some cancers that are caused by viruses like HPV and Epstein-Barr virus, like the cancers in the nasopharynx, which is very common here in Asia, and cancers of the tonsil and the back part of the tongue, which is also caused by HPV, which we see a rising incidence of lately. Third, of course, which we cannot discount, but I think is the biggest gap in what we know, is the genetic factors that makes a patient predisposed to developing cancers in the head and neck. We do have studies that show, even here in the BCI, that there are families with specific types of cancer that we don't usually see. So it is an exciting time for research in head and neck, I suppose. But all of these patients are treated individually, per patient, per risk. And that's the advantage of getting treatment here.
Wow, thank you so much for sharing that with us, Dr. Mejia. We really learned a lot, and we're really interested to see how the Benavides Cancer Institute could grow from here.
Thank you, Chelsea. Happy to be here.
For head and neck cancer patients, the UST Hospital has facilities that cater to their needs, such as the Medical Arts Building, which is composed of private clinics. Another place where head and neck cancer patients are received is the Ear, Nose, and Tongue or ENT outpatient department. Here to give us more information is Doc Randall. So, salamat po sa oras niyo today, Doc. So, matanong lang po namin, what are the services provided in the outpatient department and ano po ba yung flow of management ninyo for the head and neck patients?
So basically here in the ENT OPD clinic, we are the catch basin of patients with complaints within the ears, nose, throat, and for those with head and neck masses. So basically when patients come in, we assess them via complete history taking and complete physical examination. And for those with, we can assess and manage here in the clinics. Usually we manage it here now. But for those with head and neck tumor or head and neck malignancies, usually we assess them here first and then we refer them to our specialized center at the ENT Center for further evaluation and management. Usually comprises of complete hearing testing, endoscopy, and biopsy. And for those with head and neck malignancies which are already diagnosed, we also refer them to our BCI or our Benavides Cancer Institute for those patients.
Depending on the recommendations given in the OPD, patients are ideally directed into the specific clinics tasked for their needed services. For head and neck cancer patients, the Center for Otorhinolaryngology or the ENT Center is the usual destination wherein various services are available for the different types of condition. To give us more information on the ENT Center, we have Dr. Gloria joining us here today. So, Doc, ano po ba yung usual services na ino-offer dito sa ENT Center and sino-sino po ba yung mga pasyente who needs these tests and services?
Okay, so the UST Hospital, we are very lucky that our ears, nose, throat, head and neck surgery center, or what we call as the ENT Center, is actually an apex center. So we are being patterned upon by other centers in other hospitals. So we try to accommodate all the diagnostics and therapies that patients with head and neck cancer need, so that they will only go to one place. Okay, so the services that we offer here, we have primarily hearing tests. Okay. Another important diagnostic procedure that we do here is the endoscopy, wherein we insert an instrument into the nose or into the throat of the patient to have early detection of, let's say, masses that are not readily or easily visible. And then we also try to assess the extent of the tumor or the cancer. We are also capable of evaluating their voice if it's affected, their swallowing capability, and we are also able to do biopsy. The center is also equipped with an ultrasound. So we have a point of care ultrasound. We do the biopsy under ultrasound guidance. And it actually helps us increase the efficiency of the results so that, we will help the patients not go back and forth to have non-diagnostics. So here is our ears, nose, throat, head and neck surgery center. So we have a spacious reception for all our patients, including head and neck cancer. So here, coming from the reception area, we have one side dedicated to hearing and balance testing. So we all have here the room for the speech and language pathologist where they do the assessment and the therapy. And then we have several rooms for hearing testing. The hearing test depends on the age of the patient. So usually for children and then for balance. And then part of the assessment, we also have here the endoscopies. So we have 2 rooms for endoscopy. So this is the endoscopy room 1. Here we do have the equipment to perform the nasal endoscopy and the laryngoscopy for our patients. So we will see early detection of masses. We have the point of care ultrasound. So we have our own ultrasound equipment to perform ultrasound guided biopsy for our patients. So those are the services that we do in our center.
Head and neck cancer patients, like all types of cancer, requires more than just one specialty. Hence, the aforementioned multidisciplinary approach of the BCI. For varying disciplines to work together, doctors of different backgrounds come together during their weekly tumor board meetings to discuss related cancer cases and their most appropriate line of treatment. Joining us now is Doc Ian, who will talk more about the tumor board. So hello po Doc Ian, may mga iilang tanong lang po kami para sa'yo. So ano po ba yung kadalasang nangyayari sa mga tumor board meetings?
Okay. Basically, all the units at the BCI, the Benavides Cancer Institute, has their own specific specialty unit, and usually under head and neck the unit, we conduct a weekly tumor boards. This is apart from the usual multidisciplinary meetings that we conduct based on the need of a specific cancer patient. Actually, even non-cancer patients, if we have cases where we meet certain dilemma or difficulty in decision making, we meet collectively as a multidisciplinary team. For the tumor boards, so outside the multidisciplinary meetings and outside the clinic, our team, which meets usually every week, morning of Wednesday, wherein we discuss the patient and we make decisions, whatever the patient needs, if there's a diagnostic dilemma or if there's a treatment dilemma. So we collectively meet to discuss what will be the best approach for the patient with the highest level of evidence. Then we submit this as recommendations to the different attending physicians.
I see po. So, doon talaga makikita natin kung gaano sila ka-multidisciplinary and they're really trying to treat all of their patients holistically. So, with that, we'll move forward to the next question po, Doc Ian. So, paano po ba sila nagko-collaborate together and sino-sino po ba yung, ano po bang mga subspecialties yung very pertinent po pagdating sa tumor board?
Yeah, good question. Others will perceive a multidisciplinary team as just a simple referral to the different specialties, but that's not how we conduct the tumor boards here in UST. So apart from the different subspecialties like Med-Onc, Rad-Onc, head and neck, both from ENT and general surgery, and our partners from family medicine, PalCare, and anesthesiologists for pain management, and our pain specialist colleagues. We also meet together with our pathology colleagues, our radiology colleagues, and fields in head and neck cancer management. We also have on board our nutritionists, dietitians. We also meet with our dental colleague. Here at the ENT Center, we also house a multi-specialty clinic also with speech pathology for voice and swallowing rehabilitation. Later on, you'll be toured. Marami pa.
That's very interesting to hear naman po. And last naman po, since the tumor board meets po para makagawa ng maayos na patient care plan eventually po sa mga sinaserve ninyo, paano nyo po ba nade-determine yung final treatment or yung final say for a certain patient's case?
Okay. We always put the patient at the center of our decision. So that's a patient-centered approach. And we make our decisions based on tailor-fit our decisions based on the specific scenario, specific circumstances, and collaboratively we make recommendations based on the highest level of evidence that the patient can tolerate. We submit this as recommendations.
Thank you so much po for answering our questions, Doc Ian.
Thank you.
Head and neck cancer continues to affect patients nationwide and worldwide. Thankfully, our hospitals have designated centers for specific conditions, which keeps operations smooth and efficient. As we have seen from our tour earlier, there are different specialties that work together for head and neck cancer patients, highlighting the essence of a multidisciplinary approach in the process. We hope you have learned something new from this episode. Certainly, things do not just stop here, as the upcoming episode will discuss the specific treatments for head and neck cancer patients. We still have a lot in store for all of you, so stay tuned. Once again, I am Chelsea Roshana, and this has been Lifeline, the show where we improve our lives by feeding our minds.